Oh, wait. So today we're going to take a deep dive into something that could really shake things up in healthcare.
Oh, yeah. This is a big one.
Yeah, it is. We're talking about Dr. Mehmet Oz.
Dr. Oz, yeah.
And his nomination to be the head honcho over at the Centers for Medicare and Medicaid Services.
CMS.
CMS, that's right. And this is a big deal for anyone listening because CMS basically runs health insurance for like 150 million people.
Yeah, Medicare,
Sure.
Medicaid, the Affordable Care Act, it's all under their umbrella.
It's huge. So the big question for us today is, who is Mehmet Oz and what clues do we have about what kind of leader he might be based on what's out there right now?
Right. And he's a familiar face for a lot of people from the Dr. Oz show, of course.
Right.
But he's also got that background as a heart surgeon.
Right.
So now President Trump has nominated him for this really important position.
Right.
And what we're trying to do in this deep dive is really look at what came out of his Senate confirmation hearing. What were his priorities? What were the big questions that came up? And what do our sources tell us about what CMS might look like if he's the one in charge?
Right. So let's jump right in. What did Dr. Oz himself say were his top goals if he gets this job?
Well, a couple things really stood out right away.
Okay.
First, he was really strong about wanting to fight healthcare fraud in Medicare and Medicaid.
Okay.
And these are huge programs. We're talking about $1 trillion every year.
Wow.
So there's a lot of room for, billing problems and things like that.
Right.
And he was specific about going after insurers who bill for things that they never actually did any treatment for.
Okay. So like making a diagnosis, but not actually giving the care.
Exactly. And that's been a problem for CMS for a long time.
Yeah.
And it's hard to crack down on it because there are so many claims and people get really creative with their schemes.
Yeah. Yeah. And I imagine with that much money floating around, it's got to be hard to catch all of it.
Absolutely. So it'll be interesting to see what Dr. Oz actually does beyond, just saying he wants to target these insurers.
Right. Are there specific plans? Does he have, ideas about how to implement this?
Yeah. What tools is he going to use?
Right. Exactly.
That'll be something to watch.
Okay. So that's cracking down on fraud. What else is on his to-do list?
Well, the other thing he talked about was a much bigger picture idea.
Okay.
He wants to actually make Americans healthier.
Okay.
He called it a monumental opportunity, even a generational opportunity, to really change healthcare and help people stay healthy for longer.
Okay, so is he talking about public health campaigns? Is that what he's...
It sounds like he wants to focus on making it easier for people to make healthy choices.
Okay.
Rather than just telling what to do.
Right.
And he actually framed good health as a patriotic duty.
Wow, a patriotic duty? That's not something you hear every day when you're talking about healthcare. It's really interesting.
And it could mean a change in how we think about healthcare.
Right. Is it more individual responsibility?
Possibly. Yeah. Maybe even tying health outcomes to national well-being in future policies.
Wow. That's a really different way to look at it.
It is.
So we've got tackling fraud and this big idea of improving overall health.
Right.
Did he mention any other specific policy areas he would focus on?
Yes, he did.
Okay.
Technology was a big one.
Okay.
He talked about using AI and telemedicine to make things more efficient and to reach more people.
And especially, I imagine, in rural areas where it's harder to get to a doctor.
Exactly. Closing those gaps in access.
Right. So when he says AI and telemedicine, what does that actually look like, in the context of CMS? Like, could AI be used to spot fraud on a bigger scale?
Yeah, or could telemedicine help rural patients connect with specialists they wouldn't normally be able to see?
Right. Those are really interesting possibilities.
And he also talked about the problems that rural hospitals are facing. He suggested maybe partnerships between smaller rural hospitals and bigger medical centers.
Oh, interesting.
And just rethinking how healthcare works in those areas.
Okay.
He said he doesn't want any rural hospitals to close unless we have a better option for the community.
Right. Yeah, that makes sense. You don't want to just shut something down without having a plan for what people are going to do.
Exactly.
Rural healthcare is so important, and there are such unique challenges there.
Absolutely.
So it's good to hear that he's at least thinking about that.
Yeah.
What about the more, bureaucratic stuff, the paperwork side of healthcare?
Oh, he definitely touched on that.
Okay.
He wants to limit how much insurers can use pre-approvals for care in Medicare Advantage plans.
Okay.
He actually called prior authorization a pox on the system.
Oh.
He thinks it just adds unnecessary costs for patients and doctors.
Right. Yeah, it can be a real headache sometimes trying to get things approved.
It can.
And what about Medicaid? Any thoughts there?
Yeah, he said he's in favor of work requirements for people getting benefits.
Okay.
But he also said that the paperwork shouldn't prevent people who are eligible from signing up.
Okay, so he's not looking to create roadblocks.
It sounds like he wants to streamline the process.
Okay, but that whole idea of work requirements is a pretty controversial one, right?
Oh, yeah, people have strong feelings about it.
Some people say it promotes self-sufficiency, and others worry about what happens to people who can't work.
Exactly. It's a complex issue.
It is. And did he talk about anything else related to Medicaid?
He did. He acknowledged some of the problems that are already there.
Okay.
Like how doctors often get paid less for treating Medicaid patients.
Right. Yeah, that's a big one.
And he also mentioned that sometimes there aren't enough good care options for vulnerable people, like kids, pregnant women, and people with disabilities.
Right.
So he recognizes a need to improve the quality of care across the board in Medicaid.
Okay, so we've heard about Dr. Oz's goals. Now, what about the other side of the aisle? What were the Democrats on the Senate committee worried about?
Their big concern seemed to be whether his policies would end up hurting the existing safety net.
Okay.
They were really worried about cuts to Medicaid.
And that's something that's been talked about among some Republicans, right?
It has. So they were really pushing him to say where he stood on that.
And did he give them a clear answer?
Not really. He kind of avoided making a firm commitment one way or the other.
So he didn't say he would fight against cuts?
He did say that doctors sometimes complain about how little Medicaid pays them.
Right.
But he never actually said he would oppose reducing the funding.
Okay, so I bet that didn't make the Democrats feel too reassured.
Probably not.
What else did they bring up?
Well, they also looked into his tax returns.
Okay.
There were some accusations about him using a tax code loophole to pay less in Medicare taxes. Now, a spokesperson for the Office of Government Ethics said they looked into it and everything was legal.
Okay.
But it was definitely something the Democratic senators were paying attention to.
Okay, so they were looking for any signs of, impropriety or anything that might be a red flag.
Exactly. And they also expressed a broader worry about whether coverage would go down overall if he was in charge of CMS.
Okay.
And they even brought up things he'd said on his TV show that seemed to support privatizing Medicare.
And for those of us who might not know the ins and outs, can you explain the difference between, regular Medicare and privatized?
So traditional Medicare is run by the government.
Okay.
It's mainly for seniors.
Right.
And then there's Medicare Advantage, which is offered by private insurance companies, but still regulated by Medicare.
Okay.
So the worry was that his past comments might mean he wants to shift things more towards the private insurance model.
And that would be a pretty big change for how seniors get their health care.
It would.
Yeah, I can see why that would raise some eyebrows.
Definitely.
Now, let's talk about Dr. Oz's background for a minute. How do you think his experience as both a surgeon and a TV personality might affect how he leads an agency like CMS?
That's a great question because it's a really unusual combination.
Yeah, it is.
Being a heart surgeon could give him a really valuable understanding of what patients need and what challenges doctors face.
Right, he's seen it from the inside.
Exactly. But then on the other hand, his long career in television has obviously made him a great communicator.
Right.
And given him a huge platform to reach people.
Yeah, he's definitely a well-known figure.
He is. And he's talked about wanting to use public health messages to encourage healthier lifestyles.
Oh, okay, so that kind of fits with his TV background.
It does.
But his time in the public eye hasn't been completely smooth sailing, has it?
No, not exactly.
There have been some controversies, right?
There are some sources have pointed out that he's promoted all kinds of things on his show, from supplements to private health insurance plans.
Yeah, I do remember that.
So that raises questions about potential conflicts of interest.
Right. Especially because he's a pretty wealthy guy and he's got investments in all sorts of health-related companies.
He does insurance, pharmaceuticals, vitamins, you name it.
So could those financial ties influence his decisions at CMS?
That's the worry. And he has said he'll sell off anything that could cause a conflict of interest.
Okay, but even so, his past is still something people are talking about.
Absolutely. And we can't forget that back in 2014, senators actually called him out for some of the weight loss products he was promoting.
Oh, yeah. That was a pretty big deal.
It was.
So, yeah, knowing that he used to promote all those different products, it does make you think twice about him being in charge of an agency as important as CMS.
Right. It makes you wonder if he might have certain biases or be influenced by his past.
Right. Exactly.
And this actually ties into another point that's come up, his connection to the Make America Healthy Again initiative.
Oh, right. That's the one associated with Robert F. Kennedy Jr.
Yeah, and that initiative has a lot of different ideas behind it.
Like what kinds of things?
Well, they talk about changing the food supply.
Okay.
They oppose vaccine mandates.
Hmm.
And they even question some of the accepted science in the medical field.
Okay, so they're kind of going against the grain in a lot of ways.
They are. And Dr. Oz has spoken favorably about Kennedy in the past.
Okay.
He's even said we need better research on healthy lifestyle choices from unbiased scientists.
So what does that tell us about his potential approach to CMS?
Well, it could mean he's open to trying some less conventional approaches to health and wellness.
Okay, interesting. So like maybe focusing more on preventative care and making it easier for people to make healthy choices, which is something he's already mentioned.
Exactly. And the initiative's focus on food, for example, could really play into that.
Right. It's all about creating an environment where it's easier to be healthy.
Right.
And you mentioned that there are other nominations for health agencies happening around the same time, right?
Yes, that's right.
So is there anything there that gives us more context about what's going on?
Well, our sources say that the nominations of Marty Makary for FDA Commissioner and Jay Bhattacharya for NIH Director were also moving forward at the same time.
Okay.
And the nomination for CDC Director was withdrawn.
Okay, so are these folks all on the same page philosophically?
It seems the way all three of them have reportedly expressed support for the Make America Healthy Again initiative.
Okay, so it does seem like there's a pattern here.
There does seem to be a certain direction that the administration is interested in taking with these health agencies.
Right, potentially a big shift in leadership and priorities.
Absolutely.
Now, what about the Republicans during the hearing? What were they focused on when it came to Dr. Oz?
Their main concern was Dr. Oz's plan to crack down on fraud in Medicare and Medicaid.
Okay, so back to that trillion-dollar problem.
Exactly. With so much money involved, the potential for waste and abuse is huge.
Right, and that seems to be a top priority for the Republican members of the committee.
It does.
Okay, so as we wrap up this deep dive, what would you say are the big takeaways for our listeners?
Well, we've seen that Dr. Oz has some clear goals. He wants to fight fraud. He wants to promote preventative health using technology in public health campaigns. And he's got some nuanced ideas about Medicaid funding and work requirements.
Okay.
But there are still a lot of questions out there.
Right.
Particularly about his background promoting health products on TV.
Right.
And the potential for conflicts of interest because of his investments.
And his ties to some pretty controversial ideas.
I guess that.
So it's a mixed bag.
It is.
And it's important to remember that the CMS administrator has a really big job.
Oh, yeah. This isn't some small-time position.
It affects a lot of people.
It affects the health care of millions and millions of Americans.
Right. About 150 million, you said?
That's right. And the person in charge of CMS has a huge impact on whether people can get the care they need and whether that care is any good.
Right. They also have a lot of say in how the entire healthcare system works.
It's a really powerful position.
So here's a question for everyone listening to think about.
Okay.
We've talked about a lot of different viewpoints and priorities.
We have.
And CMS is a really big and complicated agency.
It is.
So what do you think will be the most important thing that the new administrator does that will shape healthcare access and quality in the U.S. going forward?
It's something to really think about.
It is. There are so many factors at play.